6 University of British Columbia students led a project as part of our course in Working in International Health. Although we have different academic backgrounds, we have at least one thing in common: an interest in global health. We came together to form a project that would fall under the wide scope of global health. And what better way to address this issue than starting right here at home in British Columbia? We initially addressed our province's public health policies, which allowed us to identify great disparities when looking to our closest American neighbor, Washington State. Seeing the inequalities and flaws within the different public healthcare systems motivated us to look deeper at the policies and their various long-term outcomes. The United States currently remains the only developed country without a national policy providing paid and job-protected parental leave. The U.S. joins Suriname, Liberia, Samoa, Nauru, Palau, Tonga, and Papua New Guinea as the only 8 countries in the world that do not have paid leave for new mothers. The only national policy in the U.S. that currently exists under the Family and Medical Leave Act regarding parental leave provides 12 weeks of protected yet unpaid leave only to individuals who meet a number of criteria. They must be employed full-time for a minimum of 12 months at a company with over 50 employees. While corporate policies for paid parental leave can benefit American citizens, these are only available to 11% of the nation's population, which typically consists of some of the wealthier and more affluent families of the population. Those who are at the highest risk of negative health outcomes for their children often do not have access to such benefits. This lack of paid and protected parental leave has detrimental, lifelong effects on children and society as a whole. Research has shown that the first 1,000 days of a child's life, beginning during pregnancy and extending to their 2nd birthday, are vitally important in determining the risk of developing life-threatening diseases during childhood, the likelihood of graduating high school and even pursuing higher education, their future economic prosperity, and their chance of eventually having a healthy family of their own. The component of the first 1,000 days of life that is so influential to the rest of a child's life is access to nutrition during this period of development. The Center for Disease Control and Prevention, World Health Organization, American Academy of Family Physicians, and American Academy of Pediatrics all recommend at least 6 months of exclusive breastfeeding, which is often not possible if a mother is forced to return to work. In Washington State, only 1 in 5 mothers adhere to this recommendation. Breastfeeding is not only vital to a child's nutrition, but the immunity-related benefits that breast milk provides is linked to reduction in many childhood diseases. It also promotes cognitive development in children. Paid and protected parental leave is also associated with mental health benefits for parents, subsequently leading to the birth of healthy, full-term babies of a normal weight and a decrease in birth complications and infant deaths. Allowing parents to dedicate their time and energy into raising a new child has also been associated with increased immunizations of newborns and infant medical checkups, along with longer periods of breastfeeding. While Washington State passed a paid family leave law in 2007, lack of funding has this policy at a standstill. The Washington Physicians for Social Responsibility are working to create awareness surrounding these issues and their long-term impacts on the nation, as well as to adopt a paid and protected parental leave policy in Washington State. Based on the impacts that parental leave policies have on an individual's future and contributions to communities and society as a whole, we decided to ask the people of British Columbia and Washington State for their thoughts on paid and job-protected time to parent. We first traveled to Nanaimo, BC on Vancouver Island. Under federal law, Canadians are provided paid and protected time to be a parent. In BC, 17 weeks of maternity leave followed by 35 weeks of job-protected parental leave to be shared between partners is available. If pregnancy leave is not taken, parents are provided 37 weeks of parental leave. These periods of leave are accompanied by approximately 55% of income pay through employment insurance, up to $524 per week, and up to $49,500 per year as of 2015. We spoke to the residents of Nanaimo to see how these policies have affected their families and their communities.
What do you think we should do to make sure that the concept of paid maternity leave is a good idea?
And when you get hired, that should be part of your, if you decide to have a baby, that should already be brought into the contract when you start your job. So you know you're going to be paid if you leave for your children.
What support did you receive from your community society for becoming a parent, or and what difference did the support or absence of support make in your family life?
I get support from my colleagues, I get support from family.
I got the money from the government being on maternity leave and parental leave. I took it all instead of my husband.
Okay.
Taking something. My family was there and just the neighbors. Everybody was like, I mean, because she was so cute. So they just wanted to help.
Yeah.
Yeah. So.
What are you willing to have taken out of your payroll taxes to ensure that your neighbors have time to pay?
Yeah, gosh. $75 a paycheck. Yeah.
Yeah, no, I think that's appropriate. I think as a society we need to take care of our children, and that'd be one way of doing it.
How societally and personally important is it to have time to raise a child?
Oh, that's the most important thing, because kids need their own parents. They need their mom and dad. Well, and you don't get that time back ever to experience it again. You need to leave them when they're young.
Yeah.
Especially, and you need to. It's extremely important to have as much time with them as you can.
For sure.
I think, like in the first year, 2 years, like my daughter, she's turning 2 next Friday, and you can tell like the bonds that she has with the people that she's spent time with, 100%. So yeah, needs to be parents.
Joanne is a medical social worker at Vancouver General Hospital, and we asked for her thoughts on paid parental leave.
Parental leave for new parents?
Yes.
I would say I'm pro for it. I don't see why that would be an issue. I think if people are having children, then they should have benefits from the government to be able to have children. I think the way it's set up in Canada is that it's through EI. So really the condition to be able to get EI is if you're working, then the government will award you parental leave, which didn't really ever make sense to me because I don't really understand the logic of having working related to having children. Like what is the relationship between that anyway? I think my work life and my personal life are probably a little bit different. Is that like I feel very privileged to have people in my life who I would call at least middle or upper class. Like I'm not gonna deny that about myself. So in terms of my friends, my family, like absolutely they benefit from EI parental leave. What is the actual intention of these benefits? Like, is it really to support moms or young parents with children? Like, I wouldn't really say so. I would probably argue that it's just so people continue to be in the workforce and keep growing the economy.
We then traveled to Mount Vernon in Washington State to ask people at the Skagit Valley Co-op for their thoughts on how implementing paid and job-protected parental leave policies could influence their families and communities.
As a new mom, what support are you receiving from your community or society for becoming a parent?
Well, I get time off from work. That's the biggest thing. I'm getting 8 weeks off, and then I'm taking 4 weeks off of my vacation time. And then as far as community, I have my family, and I have a church that I go to, and they've been bringing me meals, which is huge. Helps me a lot. And that's basically it. My husband works from home, so that helps a lot too. For me, it's very important. We don't get paid time off, but which would be helpful considering I have loans to pay off. But that's okay. You make it work.
First of all, are you a parent?
I am a parent.
Okay, and in raising a child before the age of 5, did you receive outside help with parenting, such as nanny, daycare, other external sources?
Yep.
And what sort of work was that in?
We had she was a woman that we met through friends, actually through soccer. She was someone's mom, and so she watched our kids as well as her own kids.
Do you think that yourself or just people in general would be willing to take money out of their payroll taxes to support programs like this for paid and protected leave? Because currently the United States doesn't have this available.
Would I support that? Absolutely, but you're asking an incredibly liberal person, so I don't think America would, though. I mean, I think that we're not ready. We're barely willing to do health care, let alone take care of people who are parents.
We also discussed the issues surrounding parental leave policies with Dr. Trevor Hancock, a professor at the University of Victoria and an expert in public health and policies.
So, what can I do for you? The place to start is to understand that there's a famous quote off the masthead of a Victorian public health journal, which said a nation's health is a nation's wealth. So it's understanding that our current notion of what constitutes wealth is very narrow. It's very economic focused. But actually, if you go to the community level, what you see is that the wealth of a community is its people, its social organizations, its structure, its built environment, its natural environment, and its economy. And so from the point of view of human development, you want to maximize the wealth, if you like, of all of those. Right now, we have the balance wrong, so that we grow the economy at the expense of all sorts of other things. One of the things that we see as a cost to society and therefore avoid doing is things like parental leave. Whereas in point of fact, if you think about it the other way round and think about what are the benefits of investing in parental leave, then you begin to see the human and social development benefits. And so the economic cost stops being a cost and actually becomes an investment in the wealth of your community. I'm glad you're talking about parental leave, incidentally, because it should be both mother and father.
While in Mount Vernon, we spoke to Dr. Jean Rupert, a doctor of osteopathic medicine specializing in family medicine and public policy.
How do you think that your experience in these fields and also your training as a DO kind of applies to your opinions on parental leave policies and different healthcare policies within the U.S. and Washington State in particular?
Well, certainly over the last 20 years, I've had a lot of day-to-day experience with patients and families and individuals who are having to make life choices about healthcare, childcare, meeting their needs day to day. My point of view has to do with health and well-being of the child, first and foremost, but of course the parents and other family members also. So family formation is a time where there's a lot of needs, a lot of attention is needed, but also all the emotional changes that go with adding a new person to the family, so it's important to the parents. We know that children have better outcomes if their needs are met on a daily basis. Even in early infancy, their bonding, attachment, and emotional stability are positively affected by being able to get their needs met in a timely fashion. I think it's also part of a larger social attitude about how our collective well-being depends upon the well-being of even people we're not close connected to, like our neighbors and the children down the street, and even the children who are going to be born next year and the next year after that. So our peacefulness and well-being as a society definitely relates to how everyone is doing, but that is not necessarily part of the common discourse politically in the United States.
The Washington Physicians for Social Responsibility have proposed that 0.96% payroll tax to be matched by employers, 39 weeks of job-protected leave with full pay, up to $1,000 a week, could be provided to the people of Washington state. This is just one step towards reducing the inequality seen in the United States, many of which stem from inequalities in healthcare.